Hi, my name is Kelsey, and today I am making this video to discuss the lesson plan that I am developing for my practicum project. Let me begin by explaining what my practicum project is. I am teaching a certification in rehabilitation nursing preparatory course. The instructional design that I have selected for this course is the ADDIE model. I analyzed what training was needed within the hospital that I am completing my practicum at, and it was decided that we needed more CRRNs in the hospital, so we decided to develop this course. After that, I selected an instructional design, developed the course, and now I'm attempting to implement and evaluate how the course is going. The audience that will be attending this course are registered nurses who have a minimum of 2 years of experience in rehabilitation nursing, and because they have that experience, they have a working knowledge of what rehabilitation nursing is. So therefore, I'm able to do a boot camp style instructional design method. In this bootcamp style method, the classes will consist of smaller groups of nurses, and we will be spending 8 hours in a lecture setting along with doing some clinical practice to develop skill set. At this time, I am limited to doing 2 8-hour days due to budget constraints. The modality of the course will be a mixture of asynchronous and synchronous methods. Prior to the course, it'll be conducted in an asynchronized manner. The nurses are required to complete the self-study and read the Specialty Practice of Rehabilitation Nursing 7th edition. That way they are prepared for the classroom. And in the classroom setting, we will be doing instructor-led lectures with PowerPoint presentations, group discussion, and then doing clinical practice on the floor with certain skill sets such as digital stimulation, which is something that we find that nurses do not fully understand the process unless they do return demonstration of that. So one day we will go up to the floor and work with the spinal cord patients and do their bowel program for them. The objectives of this course are to increase the nurses' knowledge and skill set regarding rehabilitation, apply the knowledge that they learn in the course to their clinical practice, and understand the continuum of rehabilitation. Each topic that will be presented will also have accompanying objectives, but due to the time constraints of this video, I will not be going over all the objectives. I do want to talk about Bloom's taxonomy. The goal is for these nurses to be able to apply the information that they learn to scenarios that they will be presented with in the certification exam. The objectives and content align with the industry standards through improving the nurses' ability to provide hope, healing, and recovery, which is the mission statement of the hospital at Central Texas Rehab. And the topics that I will be covering in this lecture include specialty practice in rehab nursing, patient and family education, rehab across the continuum, safety and quality, functional assessment, neuroanatomy, spinal cord injury, bowel and bladder, stroke rehab, neurological disorders, neuropsychology, sensory and perception, pulmonary rehab, orthopedic rehab, cardiac rehab, and finally, pediatric rehab. And these are the topics that the nurses need to have a well-rounded knowledge on to be successful in the CRRN examination. In regards to the content, it is the student's responsibility to complete the self-study portion and do the reading as I mentioned, out of the Specialty Practice in Rehab 7th edition. And then as the instructor, it's my responsibility to ensure that I provide the students with the required reading and complete the courses in a manner that meets the learning needs of all the students. So therefore, I'd like to talk about my last discussion point, which is the teaching strategies that I have selected for this course, which are lecture, with accompanying PowerPoints, group discussion, and clinical practice. And the reason that I selected these strategies are because they meet the needs of visual, auditory, and kinesthetic learners, which is going to increase the nurses' chances of being successful during their CRRN exam by being able to retain and understand the knowledge that I'm presenting to them. And hopefully they are successful in passing the course. I would like to thank you for listening or watching this video, and have a great day.